Hello, my name is Rachel Barratt. I work at University College London Hospitals, and I'd like to present to you our work performed here on the pre-operative MRI findings and predictors of de novo stress urinary incontinence after urethral diverticulum excision. I have no conflicts of interest to disclose. Urethral diverticulum excision is known to be associated with stress urinary incontinence, and indeed it is known to be associated with the condition before surgery as well. There is limited literature on risk factors that may allow identifications of patients at a high risk of stress urinary incontinence after surgery. Currently, we perform preoperative T2-weighted post-void MRI sequences as an aid to surgical planning, but we wondered if there were any features on MRI configuration of the diverticulum that may help us to predict post-operative continence status and aid our pre-operative counselling. We performed a retrospective analysis of 122 consecutive patients over a 13-year period with a minimum 12-month follow-up. We collected data on their presenting symptoms, surgical and obstetric history, operative details, MRI and video urodynamic data, and any post-operative investigations and interventions. Our MRI images were reviewed by a specialist uroradiologist, and we recorded the anterior-posterior, transverse and length measurements, the angle of diverticulum around the urethra, the urethral length, the distance from the bladder neck and the urethral meatus, the presence or absence of loculations, and the configuration. We then performed statistical analysis to see if any of these factors would help to predict the occurrence of post-operative stress incontinence. 81 patients in the cohort had both MRI and video urodynamic data available for analysis, with a median age of 45 years. 35 patients had no evidence of urinary stress incontinence pre or post-operatively. 17 patients had persistent urinary stress urinary incontinence post-operatively, and 23 patients developed de novo stress urinary incontinence after diverticulectomy. And it's this group and those with no incontinence preoperatively that we sought to compare and assess. This slide shows the MRI findings of the three groups, and specifically I want to look at those patients who had no stress urinary incontinence either pre or post-operatively versus those patients that developed de novo stress urinary incontinence, as they're the two most clearly comparable groups, and this gives us some useful information. Looking at these two groups, we can see that there is a statistically significant difference between the transverse measurements. So those with de novo stress urinary incontinence had a statistically significantly larger value for the transverse measurement. Equally and perhaps unsurprisingly, we see a statistically significant difference between the two groups in the angle of the diverticulum around the urethra, with a greater degree of the urethra encompassed by the diverticulum in the de novo stress urinary incontinence group compared to those patients without any incontinence. And this is reflected in the configuration of the diverticulum, with a statistically significantly increased proportion of patients with new onset stress urinary incontinence post-operatively having a circumferential configuration. As mentioned, when statistical analysis was performed, we found that circumferential configurations and, as you would expect, an increased angle around the urethra of the diverticulum are associated with de novo stress urinary incontinence post-operatively. In terms of measurements, in terms of size of the diverticulum, there was no statistical significant difference in the anterior-posterior and length measurements, but there was a statistically increased transverse measurement of the diverticulum in patients with de novo stress urinary incontinence, and perhaps with slightly larger numbers in the cohort in the future, we may find more evidence that size of the diverticulum is important, as you may expect. We analysed other MRI and patient risk factors, but nothing else was found to be associated with developing de novo stress urinary incontinence in the setting, although this is likely due to the small numbers being analysed. We believe that MRI is an important part of the diagnostic workup for patients with a urethral diverticulum. It can aid pre-operative patient counselling and surgical planning, and we hope that it may be able to identify patients at risk of stress urinary incontinence in the post-operative setting. We acknowledge this as a small data set and extra data points and numbers are required. But hopefully with maturation and expansion of this cohort, this will strengthen the data and potentially identify other factors that can be used to help risk stratify patients who are at risk of stress urinary incontinence in the de novo setting after urethral diverticulectomy. Thank you.